Hi there. Welcome to our program on organizational behavior. This week we are having Mr. Ikonne, or the director of New Life Foundation Recovery, and he's going to be talking about mental health challenges of recent African immigrants in the United States. He has a challenge, a novel view of how new immigrants in the United States, new African immigrants in the United States, cope with mental health issues. And I will not take it upon myself to introduce him. I'll just bring him on so that he can be able to introduce himself and tell us how he came to being an expert on mental health, and we'll move from there. Mr. Ikonne is yours. You can go ahead and tell us about yourself.
Thank you, Dr. Amakobe. It is a pleasure to be with you today, and I want to thank those who are watching and who watch this program. My name is Morgan Ikonne. I am the director of New Life Foundation Recovery, located at 11 Parkway, Newcastle, Delaware, United States of America. To the question, how did I come about this? Mental health issues, substance abuse issues is a passion. It's a passion that I've had over the years. And this passion stems from the fact that I believe that mental health is health. And what I mean by that is there are three basic health areas that each person, individual person, has to effectively attend to: their spiritual health, their physical health, as well as their mental health. These capital health areas of life requires attention and requires a lot of care for there to be wholesomeness. And as an individual who believes in holistic living and holistic life, it is a passion of mine to see that people understand mental health, especially among African immigrants who are recently settling in the United States. I am a certified advanced drug and alcohol counselor. I'm also a licensed clinician with mental health focus. And my hope today is that what we're going to discuss will be beneficial to you, especially the African immigrants who are recently settling in the United States of America.
That's good. You know, people don't live in a vacuum. So, whether they're living a healthy life or unhealthy life, they're living among us people. So, what I'd like to get hear from you is what kind of resources are available for people who are settling in the United States, particularly in Delaware where we live, which can be able to help them to settle. Who are the individuals? Who are the groups? What are the structures? And what are the processes they can take to make sure that they are mentally healthy when they are living here?
Unfortunately, there is no established organized system for the African immigrants in the United States, and particularly in Delaware. It's an unfortunate situation because of the lumping together of Black-skinned individuals as African Americans. Therefore, there is no separation or data available to really speak to the peculiar need of recent African immigrants in the United States. Structurally, I would think that the only thing that exists, to the best of my knowledge and data available, are communal setups within the African immigrant communities. For example, you have a Kenyan community coming together, Nigerian community, Cameroon community. Those social networking and interactions are what is available. There is no defined medical mental health setup that addresses the mental health need of the African immigrants in particular in the United States or in Delaware. And it is very unfortunate and it is very challenging.
That's new to me, because what's so peculiar about African immigrants? I mean, I know for sure that we have a tendency to oversimplify. Human beings have a tendency to oversimplify, because we say we put everybody from Latin America to be Latinos. We don't distinguish between Cubans and Mexicans and Uruguayans, and we have seen it. We have seen it being used as if they are one monolithic body. And you are telling me that people who are Black are not necessarily the same. Explain.
The truth of the matter is that Africans of recent descent or recent immigration descent to the United States of America, yes, they are Black Americans or they are Africans, even those who have settled here through the process of slavery and slave trade, and whose parents and grandparents and forebearers came from Africa during the time we're speaking about, through the slave trade and all that. But their assimilation into United States has taken a longer time. Their culturalization processes has been that which has somewhat normalized. They have a distinctive history and a distinctive cultural dispositions as against Africans who are of recent descent to the United States of America. Let's take, for example, in the issue of language and expression and phonetics. You are a Kenyan, I'm a Nigerian. The first thing people notice is that distinctive intonation of you and I. African Americans who have been here for generations do not have that. When it comes to cultural practices also, Africans of recent descent are still very much acculturalized to their countries of origin. There's still a strong tie. You travel home because you have families in Kenya. I travel home, I have families in Nigeria. But African Americans don't have that. This has been home for them. This is also home for us. But there are distinctive, unique, particularistic features that are differentiating between, even within the same monotonic group of people. Cultural views are different, world views are different, religious inclinations are different, cultural practices are different, as well as disposition to mental health issues. They are all different. They are not attended to in the same way within that monotonistic group of people.
So basically what you're saying, that in our rush to do oversimplification and classifying people as white or Black, instead of classifying people as American and recent foreigners, we miss something.
Absolutely, we miss something, and that missing link impacts significantly when it comes to the issue of resources, of mental health provisions. I give you an example. If your father, supposing he was still alive, migrates to the United States of America and settles here by virtue of your citizenship, and he's legally here, his approach to his mental health issues is completely different from a man of his age who is an African American who have lived here all his life. There are cultural and there are religious and there are social norms that your father espouses to that guide and regulate his disposition to mental health issues and health in general, vis-a-vis someone of his age who has been here all of his life. So those unique distinctive differences impact in service provision. It is quite unfortunate to state that Africans of recent descent do not have a significant trust within and for the health system in America. They feel disenfranchised, they feel misunderstood. Sometimes there is a dismissal of their needs in terms of somebody being unable to understand them. And people feel sometimes, what is the need of even trying to explain over? Somebody gets your name mispronounced, somebody tries to ask you the same question over and again. Somebody tried to tell you, I don't understand you, I don't seem to know what you're saying. So there are many elements, as little as they may be, they are significant when it comes to care provision and also the desire of the individuals to seek for care and health provisions within the system.
What you're saying, what I'm hearing from you is that those little things that develop trust between the provider and the person seeking or service are the ones that may create a barrier between the recent African immigrants and Americans or American provision providers, which cannot be picked up because people are just saying this guy is black and not thinking this guy is actually Nigerian and he has that kind of cultural background. So basically, I hear you saying that just because somebody is Latino or from North South America doesn't mean that he's the same or he looks like they are not the same. So basically, we have to learn to stop oversimplifying people when we categorize them. But in this particular case, how does that affect first the provision of mental health services and the ability to go for the recent African immigrants to go and seek those services?
You're absolutely correct with your postulation of the problem. And the unfortunate thing is that the oversimplification and the group classification of people per race or geographical areas of descent or location is problematic in nature. And the problems with that when it comes to, let's say, Africans of recent descent in seeking for mental health treatment. Number one is that they feel misunderstood. They feel that nobody that they are going to see looks like them and may not understand them. Let's not forget that the individual uniqueness of each person is deeply ingrained within his cultural, spiritual, and religious and norms and ethics. And even when it comes to these, when it comes to seeking service provision, people expect to be free. And I speak as a therapist. One of the greatest things you want to establish is a therapeutic trust. If you're going to be able to provide services in a way that will be, resolving of the problem of the individual who comes to you. Without the sense of being understood, there is a difficulty in establishing therapeutic trust. And without establishing therapeutic trust, there is difficulty in resolution of the challenge that the person brings. To the provider, there is the assumption of the generalization that everybody who is Black has certain predispositions of mental health issues. And that generalization and predisposition sometimes creates a subtle biasness in the mind of the provider. That when someone of of my skin walks into their office or walk into a provider's office, there is already a lens by which you're being beholden. And sometimes that lens can be very overclouding of proper diagnosis and thereby hindering an effective prognosis that will lead to the resolution of the problem. There is also the language barrier. Sometimes Africans of recent descent are not coming from countries where English is their primary language. They have difficulty communicating what their challenges are. So if there is no clear communication and understanding, the provider will not be able to really have a complete assessment of what the problem is. And there is also the problem of approach. Sometimes providers tend to take a very generalized approach as against an individualistic approach that tends to underscore certain genomic factors and individualistic factors that is peculiar with that person.
Oh, okay, no problem. What I see that okay, it's not normal for any professional to have a certain perspective, but how do we solve that so that the perspective they take is advantageous, not disadvantageous?
I think the foremost thing is for providers across the board to recognize the uniqueness and the particular individualistic, let me put it with the uniqueness, and also to incorporate into their practice a particularistic approach that underscores that everybody who is Black does not necessarily have the same genetic origin in terms of where they're coming from. That is number one. Number two is to try the best they can to have people of color and diversity, to put simplified, to accommodate more diversity in our healthcare and mental health provisions, where people who are of African recent descent can always be able to interact with someone who looks like them and who could possibly understand.
Oh, that's good, because the peculiarity and the uniqueness that they come with may be missed if it's somebody else who don't understand their culture, but if it's somebody who understands their culture, and then they'll be able to. But I would like to say this. First of all, mental health per se is not something that the Africans in Africa really take seriously. So is that something that African immigrants bring over with them, or do they switch when they cross the Atlantic?
No, absolutely. They bring it over when they come over. There is a saying that you do not teach a grown man how to use a left hand when he's grown. It is unfortunately that mental health is not considered as health, in the sense that it is not looked upon as a necessary element of holistic living. So we do transpose that when we come over, and it have a significant negative impact in the understanding of the necessity for mental health awareness and mental health treatment, even here in the United States.
Okay, now how do, being a professional in this particular field, how do African immigrants cope with mental health issues here?
I think that's a very good question. Let's begin by establishing that the denialism of mental health is a big problem. African immigrants in the United States denies mental health as a problem. So you cannot be providing solution to something you've not agreed is a problem to you. Secondly, is that there is the tendency of engaging engaging in other activities as a way of resolving mental health issues, activities such as religiosity or over spiritualization of the mental health issue. What we consider social drinking, which often goes overboard. So alcoholism is another transcendental experience that they engage in to address their mental health issue. And thirdly is the issue of workaholism. African-American immigrants who are recently sent tend to work excessively, 3 or 4 jobs. And that sometimes is a way of escaping the realities of their mental health challenge. And none of that is healthy. None of that resolves the problem.
How do you tell the difference between somebody who's just working because of the economics and somebody who's working to cover it up? I can imagine somebody who's drinking to cover a problem, but I still can't wrap around my head about somebody who's working just to make sure that they are covering other problems. So as a professional, I'm not asking you to diagnose people, but I just to make sure that people know when they are going to cross that bridge.
I think the truth to the question you're asking me is that every individual finds what we call a transcendental experience of escape. To some individuals, it may just be alcoholism, it may be other things, but to some it is becoming a workaholic. The thin line with that is that element is justifiable. The thin line with that is that sometimes it is so subtle that is the individual in question knows why you're picking the next job. The person knows, am I picking the next shift as a way of escaping some of the challenges I'm facing at home? If the mental health issue they are dealing with is occurring within their home front, that becomes an escape. I have had clients who have expressed that. I would rather be at work than come home, because when I come home, it is just chaotic. It is stressful. It is this, it is that, it is the other. And when you ask them, do you know that you have some mental health underlying to these challenges you espouse? No, it's just normal family issue. No, it's not normal family. So when picking up more work hours and more work opportunities is an escape to the realities and the challenges that an individual is confronting, then it becomes a transcendental escape route for that person.
How can employers be able to be helpful in this matter? How, as an employer, would I know when somebody is coming to work because they are escaping something or because they are coming to work?
That's a very important question, but to answer that question, I think it's also important that we underscore there are so many factors that could inhibit even the employer being able to do that. Number one, people are free to work as much as they want to work. Number two, if there are no, within that organization, if there is no established policy that requires at least an annual mental health evaluation, then how are you going to know it? Also, if there are no policies in place to help mitigate some problems that people may have at home front that can spill over into work, meaning if there is no periodic supervisory assessment that is broad in nature, not just performance scales of how the person is doing, for supervisory policies that is broad, that incorporate mental health questions as part of the review, then that is going to be problematic. That's not going to be able to show. Employers can help by formulation of policies that encourages mental health evaluation. They can help by incorporation of reviews that is broad enough to capture when there are mental health issues going on.
That's good. The other challenge is religiosity, as you said. I would like you to say a little bit about that, because that is bordering somebody's faith. So when is religion a cover to a problem and not healthy?
I think I'm going to tread very carefully, very, very carefully. I am a pastor, as you know.
Yes.
And I don't want anybody to misconstrue what I'm saying. Let's first establish, no matter the faith you espouse, those of us who espouse Christianity, our tenant text, which is called the Bible, is very explicit in terms of the scriptural understanding that mental health issue does exist from the Old Testament to the New Testament. There are also scriptural texts that encourages. Jesus says that the person who is sick is in need of a physician. That is an acknowledgement that people do have challenges that require medical attention. Back as Genesis, when God created man, those who believe in creation, one of the commands he gave to him, he said, I give you all herbs for food. The Hebrew word there food is medicine. So there is an acknowledgement within scriptural text, the need for medical remedy. However, the challenge exists that a lot of people over spiritualize their mental health challenges. And they do so in quote unquote as an expression of faith. And the stigmatization that is attached to the idea of you not having faith becomes a discouragement to people seeking mental health treatment when they need to. So when does somebody escape with religiosity? When there is a denial and a refusal to acknowledge that the challenge that he or she is presenting with or has is stemming from mental health and against us.
So same question I asked about an employer, about pastors. Just as a pastor yourself, how would you be able to help families when you know that this particular case requires help? How do you, I would use a Christian one, discern when this person who's coming to church every day really needs to go and see a mental health practitioner?
I think the first thing is that pastors need to develop pastoral therapeutic relationships with their members or parishioners. Is important that you get to know those who come to your church and get to interact with them. It is also important that pastors be observant of changes in demeanor, in physiological dispositions of their members. Not to excuse everything as life presenting itself. And when you have the opportunity as a pastor to sit in pastoral counseling, it is important that you do not tend to answer every question that they present to you from a spiritual vintage. There is need to encourage people and to demystify the idea that mental health issue is it is a lack of expression of faith. It is not. So I think using the pulpit as a way to encourage and to teach and to educate and to disseminate healthy information, that there are certain health challenges that require one who is an expert in that field, a very good place to begin.
Good. That's good but challenging. What I would like to see, because a lot of African immigrants of recent descent work in healthcare. We have a pandemic now, and the mental health issues that are arising because of the healthcare workers working with COVID-19 patients is high. How do you think the professionals of African descent are coping?
I think that everybody is traumatized. When the pandemic began, I did write some articles and posted on LinkedIn about the post-traumatic stress that is going to be very evident among among health care providers and healthcare workers. The unfortunate thing is that there is really nothing being done to address that. And that's very unfortunate. So I think that African immigrants of recent descent in America, greater percentage work within the healthcare industry. And my fear and my concern is that there is already an existing predisposition of dismissal and denial within this group of people as to the impact of mental health issues. And now that they are exposed to trauma, and there are no legislations or policies that are enforcing them to look at their mental health, that is quite challenging for me. So I do not think that they are coping very well, in my estimation.
That's the definite of things coming together where this community does not recognize mental health, or rather, it does but dismisses it. And then they are now in a position in an industry that is completely predisposed to mental health issues, but they may not be able to see it. You as a practitioner, what is the solution? How do you reach them to make sure, first of all, make sure that they know that they could be mentally unhealthy and that they should seek help?
I think the foremost thing is to advocate. We must engage in advocation, also in sensitization and education. I think that Africans of recent descent are quite engaged within the social networks and structures of their communities. It is important that those of us who are within the field of mental health and health provision engages with leaders within these communities to have symposiums and workshops that demystifies the challenges of mental health among African immigrants of recent descent. That's very important. The second thing is to utilize every platform that we have. The social media platform is a good platform to continue to provide sensitization and education that is targeted to address the issue of mental health issues within the African immigrants of recent descent. Thirdly, is to encourage our religious leaders within the community to become a voice in the fight of sensitization and education for mental health. People believe they are pastors. I'm a pastor. People believe they are pastors. When pastors step up the game and organize workshops and trainings and seminars to address this issue, it is going to stick. So I think that communal engagement is needed very much. And lastly is that those who are within the industry, healthcare industries, needs to be encouraged to begin to be involved in policy decision making that can help to mitigate these problems within the system.
Okay, that's good. The structure that you've really mentioned is the churches, because African immigrants are most likely, you've touched on, believe they are pastors. And their churches are important structures that can be able to help in this matter, you say. and the processes that they may follow is like the trainings and the preachings should actually attack or face this challenge that we have. But how do you convince people who don't know they have a problem?
I think that's a difficult question because, as you know, within service provision, your job is to educate and sensitize. Conviction is not necessarily your job. Even as a pastor, my job is not to bring conviction. My job is to speak truth and hopefully present it in a way that it is appealing and in a way that the individual can see the rationale. But I think that approach is important. Everything kind of revolves around approach. If there is a demystification and there are evidence-based truth that are being presented, people will listen. And when you can relate to where they are and have examples that truly speak to the realities of where they are, they will listen. Sometimes the challenge is that we bring people who don't look like us, who don't speak like us, who don't understand our cultural dynamics to speak to us. And the challenge is that the assumption that we had before we came here continue to perpetuate itself, and the dismissal continues. So I will encourage, bring people that looks like your people, that understand the uniqueness of their lives and their culture, to speak to them from the expertise and experience, and that will greatly help.
Super. We call it mental health, but you know, when I go to a doctor, when I go to my family doctor, my insurance pays. So walk us through when does somebody decide they have, because if I'm having a cold, I know to call my family doctor. How do I decide that now I need to talk to a mental health professional, and who pays for that? Do I pay from my pocket?
That's a very good question. There are symptomatic indicators of underlying mental health challenges. Let's take anxiety and depression, for example. When someone is depressed, he or she is fatigued, he loses drive and motivation. The tendency to be upbeat is completely gone. And when that happens consistently for a period of time, it requires that you don't just dismiss it as work fatigue, especially when there is an extreme lack of motivation. And when anxiety presents and there is fear and there is uncertainty and there are those physiological indicators of extreme anxiety, palpitation of the heart, unnecessary sweating and fright tendencies and panic, that needs to be considered to be beyond just, I am worried about something. And because most people do not know, if they do have such, I encourage, this is important, African Americans of recent descent, please do your annual medical checkup. It is important. It saves life. When you do, speak to your primary physician and answer the questions honestly. It is important. The primary physician has the responsibility of referral. When he or she refers you, your insurance do cover your mental health challenges. And some employers also have coverages that can, help deal with the cost of assessing mental health services. So your insurance do cover it. Call your insurance if you're not sure. There is a 1-800 number for customer service. Call it. It's at the back of your insurance card. they will tell you if you're covered and what kind of services you can be covered in. If you're not working, call the hotline Delaware, which is 211, and ask. There will be someone from Department of Health and Social Services that will navigate you and refer you to community organizations that can help you attend to your mental health.
Okay, that's good. Now we have to turn to substance abuse. We touched a little bit about alcohol as a cover for mental health, but you are an expert in substance abuse. Tell us a little bit about substance abuse, generally in the and amongst recent African immigrants.
Unfortunately, there are no substantial data when it comes to substance abuse issue among Africans of recent descent. There are no substantial data that can be looked upon. The reason being what we've been discussing, that African immigrants of recent descent really takes their mental health or their general health to be something that they attend to. So substance abuse falls in various categories. There are people who are what we call substance use disorder by virtue of them abusing prescribed medications for anxiety, depression, or even sleep. When someone is abusing their medication and comes to the point that he or she cannot function without the abuse of those medications, he or she now is addicted. Alcohol use disorder, there is a difference between that and alcoholism and as well as social drinking. Most African immigrants of recent descent engages in social drinking. And some of them do not know when they cross the thin line between social drinking and alcohol dependence. They drink to the point of intoxication. Once somebody is drinking to the point of intoxication, even if you're drinking in your house, you will become an alcoholic. Once you cannot function, once you begin to have hangovers, you begin to run to alcohol as a way of escaping the realities of your life, there is a problem. And the good news is that it is treatable. Substance use disorder is treatable, alcohol use disorder is treatable. But it requires courage and understanding with the individual to seek for help. So I will say that the foremost thing is to recognize that these problems do exist.
That's good. The problem does exist, but we know that the war on drugs has made it criminal. So when does somebody decide to seek help when they know they basically would be going to jail?
I would differ with you on that. There has been recent laws that have been passed to decriminalize people seeking for help. For example, in Delaware, there are a lot of laws in place today that if somebody is found either OD'd or in a state of, about dying out of substance disorder, whoever, even if is a drug dealer that brings that person to the hospital, law prohibits that person to be arrested. You are not going to arrest the person as long as he or she is doing an action that is for saving of that life. It is also important to establish that seeking for substance abuse treatment does not translate to somebody being locked up for it. No, actually, people are encouraged to seek for treatment to avoid them falling into criminogenic factors that are comorbid with substance use disorders. So there is a lot of good news in terms of legal remedies and legal prohibitions that are out there today that is good for the individual who is seeking treatment. When it comes to drug dealers and all that, that's a different ballgame. But if somebody is seeking for treatment, he or she is not going to be arrested for that.
Okay, but you know the community you're talking about. Maybe 75% of them are legal. They are okay. They can go seek help, or they can talk to somebody about being helped. But the 25% of them have immigration challenges. You see the complication where we're coming from. We have a group of people who may have immigration challenges, and they are not culturally attuned to seek help for mental issues, or get what can I say? They culturally don't think that they think that it's shameful for somebody to be drinking to the point, or to be using drugs, so they don't want to say it. There is shame on it. There is shame in outing themselves culturally. True. So speak to that. The culture of the culture that says it's shameful to be a drug addict or to be an alcoholic, so you don't say it. If you don't say it, it's not there.
I think that's a major factor when it comes to African immigrants of recent descent. Is a major factor. The stigmatization, the shame, the cultural disposition, especially among men. It is considered to be something that is not manly for you to be talking about that you want to go seek help because you got drunk. That's a very big challenge there. I will begin by encouraging. The good thing about the African immigrant community is that we exist within communities or within units, in our community. Dr. Amakobe, somebody who just came into the country, who may have challenges, and you've been here a minute. So if we can individually engage in advocacy and education, it is going to help. Secondly, if we can begin to encourage the same advocacy within our social structures, it's going to help. Number three, and I will say strongly, is that the good thing within this country is that there are so much laws that are protective of the individual. Even if you are illegally here and you have a challenge, you can seek for help, and that help can be provided for you. So the fear of repatriation, the fear of being sent back home if I come out and say I have this problem, needs to be demystified. Not that it does not exist, it does exist. But every provider has ethical responsibility and have HIPAA laws that he or she must abide by. It is as serious as that by HIPAA laws, it's going to take a lot for me to divulge your information, even when I am subpoenaed by the court. So there are a lot of protective mechanisms that are there for the individual once he or she steps out and start assessing help. However, the challenge is the financial element of it. New Life Foundation Recovery came about to provide solution to that. We provide services even to those who are not insured by doing what is called sliding scale, where people can pay for what they are able to, but they are not denied services, because we believe that each life matters, each individual life is important, and money should not be the deciding factor if somebody lives or dies.
Good, thank you very much. Time has gone so fast, so time is against us. So I'll just give you 1 minute to close it out. Say something to the African immigrants about mental health that will make them survive and thrive in this country?
My fellow Africans, I want to thank you for the opportunity for me to even reach you through this medium. I want to establish foremost that mental health is health. The way you take care of your physical health, your spiritual health, your emotional health, your financial health, you need to take care of your mental health. Number two, we need to stop the stigmatization and the denial that we have so over time built into our worldview when it comes to mental health, substance abuse issues, because it is hindering us. The truth is that if you're not healthy mentally, you cannot function and you cannot prosper materially. This is not home where you have a lot of family members to come to your rescue. You got to understand the system that once you are not able to perform your job and your duties, your employer is going to let you go. So take care of your mental health. And if you have substance issues, please seek help because it is the right thing to do. Thank you.